Okay, Fraser, the people want to know, what is the problem with traditional osteoarthritis treatment?
So, Mark, most osteoarthritis treatments only mask the pain instead of actually improving the cushioning and the condition inside of the joint. So, Arthrosamid is really the new kind of Ferrari of pain treatments.
Welcome back to the Odyssey Method with Fraser Johnston. Fraser is the founder and CEO of Enthiomed, which is Kelowna's premier clinic for alternative pain treatments and a world leader in psychedelic therapy. Fraser pioneered the Odyssey Method, which is a holistic psychedelic therapy model designed to create everlasting change. And in this video, we are going to be covering how Fraser's clinic, Enthiomed, treats arthritis. So, Fraser, you mentioned a big word at the beginning, which was Arthrosamid. I think I pronounced that right. What is that, and how is that used in osteoarthritis?
So, Arthrosamid is a treatment designed by a company. So, it's a non-biodegradable hydrogel injection specifically designed for knees, but then we're also looking at it for other peripheral joints like hips and knees. So unlike kind of traditional steroid injections or hyaluronic acid injections that typically, you might get relief for, a week or two and they can wear off quickly, Arthrosamid actually integrates into the synovial lining of the joint and acts as kind of long-term joint cushioning.
Is this like you said long term? What does this compare to the traditional sort of treatments of? I think you said some form of steroid that is used to treat osteoarthritis. How does this new treatment compare in terms of how long it lasts?
So beautiful question. So yeah, your traditional kind of like cortisone injections are more just kind of pain killing injections. So get rid of the pain so you can walk around without pain. Whereas what this is actually trying to do is reduce inflammation, improve a bit, mobility, and then actually can offer pain relief that lasts up to 12 to 24 months that we're seeing from some clients in the clinic.
That's really, really powerful. I know I personally, my family has a history of osteoarthritis. And yeah, most people were like, a lot of people in my family complain when people just try to solve like the symptom. And it's like, no, we
Mhm.
want something that is not just reducing my pain and like helping me manage pain, which is an important piece of it, but really to like, provide more sustainable solutions from a medical point of view. Do you have any stories of clients that have used this? Because this is a new treatment, right?
Yes, so it's really come out in the last kind of, I'd say, 6 to 12 months. So yeah, arthrosamid's not your typical quick fix like just that cortisone injection. It actually provides structural improvement to the joint environment. So, some client success stories we've had in the clinic, we actually have a lot of people travel up from the US, and we've recently just had a gentleman come up and he had both of his knees done when he was here. And he's seen such great success over the last 3 months with it. He can move around. He's actually back at the gym, pain-free. So yeah, seeing some really good improvements there with just the joint condition and overall life quality as well.
Wow. And how does the cost compare for these treatments? And let's not consider insurance at this point of view. Is it more expensive than the traditional or steroids? How does that compare?
Yeah, so I'd say definitely a little more expensive than your traditional treatments. Whereas with the traditional treatments, you're relying on kind of repeated injections where you get that short-term relief, or you're, on medication for the rest of your life, just trying to manage that pain. So an arthrosamid treatment runs about 4 grand, for a joint, and then there is discounts there if people are doing multiple joints as well.
And is that 4 grand Canadian? Because I know your clinic, Enthiomed in Kelowna, treats Americans, Canadians, and people from all over the world. But is that $4,000 Canadian or
Yes,
US?
we're all priced in Canadian for sure, and we're actually a little cheaper than some of the other clinics too, especially out east in Toronto, etc.
So for the Americans listening out there, that's like a roughly $3,000 USD. So a little bit actual, less expensive as the sticker might entice you to think it is. So I want to talk about this actual treatment. Is there a difference between like the people you accept for this treatment versus the traditional route for treating osteoarthritis?
So yeah, the physicians will definitely do, some ultrasound work to see what the condition of the joint is, just to make sure you're a suitable candidate there. So we always do a consultation with people to make sure they essentially, their joint is in the right condition where they would actually receive benefit from this.
And what about the risks or side effects with a treatment? Obviously, this is something that is relatively new, but are you aware of what the different downsides of it could be?
So great question, Mark. So one thing we actually do because it's like a hydrogel implant, we do actually give people some antibiotics after the treatment, just so their body can accept essentially that new foreign body within the joint. So we actually do see most people respond really well. So they might just take one round of antibiotics and they don't actually end up taking the rest of the course because their body's accepted it.
And so if you are interested in doing this, obviously talk to your doctor, or you can reach out to enthiomed.ca. I will link to that down below this video, and you can have a consultation with one of the doctors at Fraser's clinic. And if you have any questions about this and wanted us to dive into these topics deeper, let us know down in the comments on this video. Give it a like and subscribe, and we will see you in the next video.